Today is the first introductory class of forensic medicine and toxicology. And this is the phase 2. You are now in the phase 1. Phase 2 course consists of forensic medicine and toxicology, and another subject is community medicine. These two subjects will be taught in this phase, and you are all welcome. But today is the introductory class. As in normal way, we should introduce each other, but now in these new circumstances, I said not new circumstances, circumstances is going on for the last 7 months. We have to introduce, I first introduce myself, either you know or not. I am the Professor Dr. Dibash Chandra Dey, head of the department, and from the beginning of this medical college, I organized this department. In the department, everything is organized, collected, or synthesized by me and my colleagues. And I welcome everyone to this phase 2. Are you hear me or not? All of you are hear me clearly?
Yes, sir.
Yes, sir.
Yes, sir.
Thank you. Though it is introductory class, first you should know I introduce myself, and if in the normal way I also take the introduction from each of everyone. But in this circumstance it is not possible. My home district is at Kanpur, and I am the professor cum director of this institute. Now you first know name of the subject. Full name of the subject is forensic medicine and toxicology. Forensic medicine will be taught in the first part of the year, and the toxicology will be taught in the second part of the year. And with forensic medicine, another term is included, that is the medical jurisprudence. This subject previously called about 25 to 30 years ago, when we studied in the medical college. I passed from the Dhaka Medical College. This subject was called, when we study, it is called medical jurisprudence at that time. Now it is called forensic medicine and toxicology. And another name of the forensic medicine is legal medicine. And legal means it is tasked with the justice or the court or the medical aspects of the law. So it is called legal medicine. And before I start, I asked everyone to collect your book. Without book, you cannot understand everything, or you cannot, your reading is necessary. You go through the books after the introduction class. So I asked everyone to collect minimum one book. And which book you will collect? You consult with your elder brothers and sisters who are in the medical college. As you are in the 8th batch, you should consult with the 7th batch or 6th batch of the medical college students, which books you will prefer. But you should have at least one book. And I tried myself to you task in the simple way. If you can understand, I can also translate it into Bengali if you can understand the Bengali. So I asked previously whether you can understand Bengali all or not. And you have no response about this. So I go through in the English. And definition of forensic medicine or legal medicine is it deals with the application of medical knowledge to aid in the administration of justice. আমরা অন্যান্য others subject that is only related to the patient, disease, or any others, but forensic medicine mainly deals with the justice and it aids in the administration of justice. It is used by legal authorities for the solution of legal problems. We try to help the authority, legal authority, that is the court or the administration. If they are in problem of legal problem, forensic medicine department tries to help them and give them solution about the legal problem. Which type of legal problems? As for example, cases of injuries, murder, accidents, poisoning, sexual offense, etc. In short, we can take forensic medicine and legal medicine as it deals with medical aspects of law. In one sentence, it can be said that it deals with the medical aspects of law. And another term, medical jurisprudence. Medical jurisprudence deals with the legal responsibilities of physicians, with particular reference to those arising from the physician-patient, doctor-state, etc. relationship. As for example, medical negligence, professional misconduct, medical ethics, medical etiquette, etc. And we will give you the knowledge about these terms in the following classes. In short, medical jurisprudence can be said that it deals with legal aspects of practice of medicine. If we say that the forensic medicine deals with the medical aspects of law and medical jurisprudence deals with the legal aspects of practice of medicine, those who are practicing how they deal with the patient, how they deal with the state, how they deal with other doctor. This behavior, practice, and relationship is taught in the medical jurisprudence. And forensic medicine deals with the medical aspects of law, how they help in the legal problem. So, in short, this is the short definition of forensic medicine and medical jurisprudence. Aims of forensic medicine. When we study the forensic medicine, what are the aims? Why we should go through this forensic medicine subject? There are some aims to study the forensic medicine. First one is its aim is to find out the truth, particularly in judicial investigation. As there is any occurrence occur in the state, particularly in judicial, then forensic medicine tries and aim to find out the truth. What is the actual thing occurrence? Second one, it deals almost entirely with crimes against human beings. Those who are doing now in this situation, now for the time being, there are some occurrence occur with the female and young female kids, youth. That is the crime, and we tried almost with these crimes against the human beings. The next aims, it is mostly an exercise of common sense. Not only common sense, combination of common sense combined with application of knowledge and experience acquired from other branches of medicine, surgery, obstetrics, pathology, etc. What do you gather as a doctor from the various branches of medicine, surgery, obstetrics, pathology, IENT? You should combine with all this knowledge with the common sense and exercise it. Next, it is in case of sudden death or in accident, when an occurrence occurs as in accident, or there is a person dies of sudden death, authorities depend mostly or completely on medical evidence in establishing the cause of death and to determine the blame respectively. That this accident or sudden death, how it is occurred, and what is the real cause, and who is responsible for this. For this, the legal authorities, that is the magistrate and the police authorities, completely depend on your কবে আসবে? একই সময় না? আচ্ছা ঠিক আছে, যখন আসা আমি So, when there is any occurrence of sudden death or accident, those legal authorities, that is the home administration and the judicial, solely or mostly depend on forensic medicine with their opinion. And the aim of the forensic medicine, solely obligation is to present the truth and adding nothing. No addition with the truth, withholding nothing. No any concealed part of this truth and distorting nothing, and no any another way deviated from the truth. So, the aim of the forensic medicine expert is the sole application to present the truth. Then what are the scope of forensic medicine? You will learn later what is witness. In Bengali it is called Shakhi. And a doctor may give opinion as an ordinary witness and expert witness. You will later know what is ordinary and what is expert witness. As the doctor can give evidence in a court like just any other witness, that is called ordinary witness. And when he given as an expert of forensic medicine, then it is called expert witness. And doctor has scope to give both this type of witness. In all cases of crime involving the person, any person supposed to do any crime, then the police takes the help of medical practitioner of forensic medicine to solve their problem. In some cases, doctor is the chief source of evidence upon whose legal decision are made. As for example, in case of rape or suicidal death, either it is suicidal or murder, then the sole evidence depends upon the doctor. That is a forensic medicine doctor. All forensic medicine science expert witness must strive to receive respect, understanding, and credibility in the court. As you have to give the witness in the court, a forensic expert to receive respect. Not only give the evidence, you should also receive the respect, understanding, and credibility. You should show your credibility in the court. And the forensic expert should have the image of neutrality, impartiality, and objectivity. These three characteristics are very important. Neutrality, you are a neutral person. Impartiality, there is no party. And objectivity, that is the বস্তুগত যেটাকে বলা হয় objectivity. That is what the things that should be the thing. So three important character of forensic medicine expert is the neutrality, impartiality, and objectivity. Then characteristics. First we go the scope Then first we give the aim, scope, now the characteristics. What should be the characteristics of an forensic expert? He must be honest, he or she, what maybe, must be honest and confidence is inspired by honesty. His confidence is only due to honesty and success depends upon confidence. He should acquire the habit of making a careful note. What he see, what he observe, he should make the notes. And he should examine the facts, what he know or what comes to his knowledge, draw his conclusion logically and correctly after consideration of the case. He first note, observe, and then conclude logically and correctly. No ambiguous, only logically. A good command of language. What should be the characteristic? A good command of language, clear presentation and ability in expressing a relatively firm opinion. You should give your opinion in the court regarding the fact, and it should be clear language, clear presentation, and clear in expressing. That is, everyone should know what is you express and from your opinion. And you should be demeanor, that is, your behavior, manner, almost very equal importance. And other characteristics needed for a forensic expert: power of observation, wide range of exact knowledge, power of deduction. Not only acquire, also he or she should have the power of deduction, what is not necessary. Basic intelligence, clinical competence, caution, foresight. কি হতে যাচ্ছে, he can understand, and wisdom of the physician. All these characteristics are important for every physician. And I hope you will, when you become a doctor, that is a physician, you should acquire all this knowledge. All this knowledge are not only needed for forensic medicine, also needed for any subject. Doctors should have good knowledge of law governing their profession, along with legal procedures. When you understand everything in the forensic medicine or legal medicine, then you have acquired the good knowledge of law governing the profession, which is needed in the medical jurisprudence, along with legal procedure. Then history, not so important, I would admit. Only you should know one history, that is in 1302 AD, after death of Christmas, the first medical legal autopsy done. It is a pet question in the MCQ. Also in the Bible, you should know this. 1302 AD. First medical legal autopsy done in Italy. In the country of Italy, first medical legal autopsy done in the history of world, in the history of forensic medicine in 1302. You should know this, remember this, and try to follow it, as it is a very pet question in the MCQ of forensic medicine. You should remember this. Then what are the branches of forensic medicine? There are many branches of forensic medicine. As for example, forensic pathology. Normal pathology are not an forensic pathology. Forensic pathology deals with the application of pathological principles in determining the cause or manner of death in case of suspicious, unnatural, and unexplained death. So, part of the pathology which is needed for the solution for determining the cause and manner of death. Later you will know what is manner of death, how the death occurs, that is the manner of death. In case of suspicious, that is unnatural and unexplained death. For this purpose, those pathology called the forensic pathology. Then forensic toxicology. It is the study of poisons regarding the source, poison source, character, properties, clinical feature, fatal dose and fatal period, treatment and post-mortem finding. All these are taught in the forensic toxicology regarding the poison. Then forensic ballistics. It deals with the study of firearms. You should know what is firearm. Rifle, shotgun, and it will be taught later. Study of firearm, ammunition. Ammunition means bullet or pellet, and investigations of their use in crime. So forensic ballistics is one of the part of the forensic medicine. Then forensic serology. It deals with the blood, semen, and seminal staining with specific tests to detect crime. Forensic radiology. It deals with X-ray examination in various criminal and medical legal cases. Forensic toxicology. It is very important nowadays. It deals with the fingerprint analysis. And by this, we can detect, find out the crime, criminals. Then forensic thanatology deals with the medical and legal aspects of death. Whether death is suspicious, what are the legal aspects, what are the medical aspects, all will be taught in the forensic thanatology. Then forensic psychiatry. It deals with the application of psychiatry for evaluation of legal cases. The one may show that whether he is insane or mad, really he is insane or mad, and what is his role, and what will be the legal case. All these will be taught in the forensic psychiatry. And so it deals with the application of psychiatry. And forensic obstetrics. It deals with the normal and abnormal deliveries related to legal affairs. Then forensic odontology. It deals with the science of dentistry in legal cases. As for example, by a bite, see the bite mark, you can assume the criminals, and from these bite marks, we can find out the crime and criminals. And so forensic odontology deals with the science of dentistry in legal cases. And forensic criminology, it deals with the crimes and criminals. Forensic osteology deals with the science of bones in the legal cases. What is the importance of bones in the legal case? As sometimes the body is mutilated, one hand found in another way, one leg found in another way, body is found another way, head found other way. So it deals with osteology, forensic osteology. And forensic nursing deals with the scientific role of nurses in medical legal cases. What is the role of nurses in medical legal cases? All these are branches of forensic medicine. You should know this. You should go through this as it is one of the written question, state question for written and viva. What are the branches of forensic medicine? As you should know that forensic medicine have branches, but medical jurisprudence have no branch. Then two terms. You must understand what is medical ethics and medical etiquette. Medical ethics means it deals with the moral principles which should guide members of medical profession in their dealing with each other, their patients, and the state. In a term, it can say medical ethics deals with the members of the medical profession, how they deal with each other, how they deal with their patients, how they deal with the state, how they deal with the society. All these are included in the medical ethics. And medical etiquette, it deals with the conventional laws of courtesy observed between the members of medical profession. That is, the medical etiquette deals only the what should be the behavior, what should be the dealings with the members of medical profession. What? That is, one doctor how deals with another doctor. And it is also included in medical ethics. And medical ethics deals with this and also with how they deals with patient, with the state, with the society, everything. And medical etiquette deals only with the medical profession among the members. So medical etiquette is included in the medical ethics. And medical ethics is not included in the medical etiquette. A doctor should behave, you should know this, a doctor should behave with his colleagues as he would have them behave with himself. Sudhagata, how he deals with another doctor, he should expect that these dealings will be observed with him when he deals with another doctor. It is a courtesy behavior between the members of the medical profession and it is called medical etiquette. And medical ethics deals with this members of the doctors and patients, state, country, everything. That is the broad term is the medical ethics, and short term only part of the medical etiquette ethics is the medical etiquette. I hope you understand between this ethics and etiquette. Then why I asked, and it is a paid question in the forensic medicine, written question, why fair knowledge of forensic medicine is necessary for all categories of doctors. Why forensic medicine knowledge is necessary only not for forensic medicine, all categories of doctors. What are the reasons? The reasons are, that is the causes are, all medical work is of responsible character, especially the medical legal work. As for example, when a doctor issuing a certificate of illness, lunacy, or that is the issuing a medical certificate, then he should know what is the problem arises from this certificate and how to counteract these problems, how he should avoid this problem. All these are taught in the forensic medicine. And in all cases where crimes involved, as for homicide, suicide, assault, sexual offense, road traffic accident, all these are admitted in the surgical ward, casualty ward, or in gynae ward. But they require to appear as an expert witness in the court of law. They have to give their opinion in the court of law, so they should have sufficient knowledge regarding these crimes, homicide, suicide, assault, sexual offense, road traffic accident. If he has not sufficient knowledge, he cannot give sufficient opinion as an expert witness in a court of law. As when any doctor deals with this patient, he must attend in the court. So they should have fair knowledge about this, which is taught in the forensic medicine. And doctors from other branches of medicine, surgery, obstetrics, radiology, pathology should familiar with the problems of respective medical legal cases, casualty and manner of death. If we know all this, if we have fair knowledge about this, he can overcome this problem. So all doctors from other branches who deals with this medicine, surgery, gynae, or any other branch to know the problems of medical legal cases and their causality and manner of death, and how we should interpret it, how we observe it, how it deals with, all these are taught in the forensic medicine. Today, it is very important that general people are conscious, and sometimes doctors are sued from time to time in a court of law for their acts of omission or commission. Now, people may issue a case against the doctor for their omission or commission. What their omission means what they should do, not doing, or commission what they should not do but doing. That is the commission. It will be learned later. For these people may issue a or do a case against the doctors in the court. So doctors should have the good knowledge of law governing their profession, along with ethics, acts, codes. As we are deviated from this medical ethics, acts and codes, we are fall in troubles. And people are very sensitive to them. They sweep cases against this. And forensic medicine familiarize and prepare the doctors with legal procedures and help to lessen the painful experience of giving evidence with efficiency. All to overcome this, forensic medicine tries to familiarize and prepare the doctors with the legal procedures and help to lessen the painful experience. This is the in short about the why fair knowledge of forensic medicine necessary for all categories of doctor. It is a pet question in the Prof examination. You must go through this and know it, learn it, try to memorize it, as it is a very often comes in the written question, also asked in the Viva exam. Then between the two broad branches, forensic medicine and medical jurisprudence, In the Prof examination, another set question is definition of forensic medicine and medical jurisprudence and their differences. It is also a pet question for the Prof exam. So what we saw at a glance, what are the differences between forensic medicine and medical jurisprudence? Forensic medicines, it deals with the medical aspects of law, as we know previously, and medical jurisprudence deals with the legal aspects of practice of medicine. Activity, in case of forensic medicine, it is used by legal authorities for the solution of legal problems in a court of law. And in case of medical jurisprudence, it deals with the legal responsibilities of doctor, arising from doctor-patient, doctor-state, etc. relationship. As for example, in case of forensic medicine, injuries, murder, suicide, accident, sexual offense, poisoning, etc. All these will be taught later. And in case of jurisprudence, examples are medical negligence, consent, professional misconduct, rights and duties of doctor, rights and duties of patient, etc. Branches, as we previously taught about this, the forensic medicine have branches and medical jurisprudence have no such branches. And guided by forensic medicine is guided by criminal or civil laws, and medical jurisprudence guided by medical codes, ethics, legislation, etc. This is the in short difference between forensic medicine and medical jurisprudence. It is also a pet question for the Prof. So this is about today about the introduction of forensic medicine, where there are some pet questions very important for your exam purpose, for your life purpose, for your knowledge. That is, in short, what I taught today. What is forensic medicine? What is medical jurisprudence? What is the aim of forensic medicine? What is the scope of medicine? And what is the character of forensic medicine expert? Then in the history, I asked you to note minimum one evidence, that is in 1302 AD, first medical legal autopsy, that is the done in the Italy. First in the world medical legal autopsy. Autopsy means find out the cause of death by incisions given over the dead body. Then what are the branches of forensic medicine, and in short what they deals with and what it meanings. I asked that this should be remembered, as it is also a question set up in the Prof exam. And lastly but not last, I asked why the fair knowledge of medical forensic medicine is necessary for all categories of doctors. It is occasionally not. In every alternate year it comes in the exam. So you know it. And lastly, I taught what are the difference between forensic medicine and medical jurisprudence. As it is the first class, you have some troubles, you have some questions, you have some necessary to memorize this. You have to go through the books. So I asked you, first you collect one book and go through what I have taught today. If you have any question regarding this, what I taught today, you may ask. If you have any query about this, what I taught you regarding this, I also inform you that another assistant professor, Dr. Ghulam Khazan, is also take class in alternate days. There are two teachers regarding the lectures and three lecturers in my department. They are all expert, they are all sincere, they are very kind to you, to give you knowledge, to give you the understanding, to give you the problem solving. Now, have you any question regarding this? You may ask. I know that this is the first class. You have to every forensic medicine, jurisprudence, crimes, it is a new term. What you learn in the first phase, that is anatomy, physiology, and biochemistry. This is not included in the three subjects. It is the new term, new evidence, new cases. So you have to go through this, and I repeatedly asked you, I hope that you collect minimum one standard book about this. So you can go through this, you can rememorize what I taught you, then you can understand. If you have any problem, you may ask in the next class. No problem. Have you not any question? I hope if you have any question, you may ask in the next class. And I asked everyone to save yourself. Be safe, be healthy, and be healthy with all your members of the family. And go through these books and ask, as you have to appear in the first Prof exam, you must go what you previously learned, must go through all these, and you must take a small portion of time regarding this second page to understand, so you can understand what you are taught. You can go through it, you can understand. It is not necessary to memorize all this. Now you should understand what we taught. You should understand this. You have headache, you have clumsy, you have brainstorming regarding the first Prof examination. I know it. So you should go all your books of the first Prof, and for the second Prof you must collect one book and go understand what we have taught. First, only understanding, not to memorize, only to understand. And if you understand, you can memorize later after the first Prof. So, if you have no questions, have no query, I should have to stop here. Thank you all. This is the first introductory class with the first introduction about the subject, and I also asked you to remember that name of the subject is forensic medicine and toxicology. Hope you will be healthy, be safe, and go through it books what you need. And don't come outside the homes without any requirement. Thank you all. Thank you. Wish you good luck.
Assalamu alaikum, sir.
Walaikum salam. ভালো থাকো ইন্ট্রোডাকশনটা this introduction when in normal way with introduction you everyone where from you come from what college you passed HSC I asked everyone and I give my regarding I say that I am from the Chandpur and I passed MBBS from the Dhaka Medical College and I get the post graduation from the NIPSOM and so any other. So there should be an interaction between these two. When we come together in the normal way, then we can introduce ourselves. With this, I stop here. Hope you will, and I will take your introduction in the normal class. When we